Morning, guys. Happy Tuesday. Hope everybody's having a good start to their week. I just wanted to hop on here and talk to you guys about the number one thing that you can do to prevent an injury from turning into a chronic issue. Before diving into that, I'll introduce myself for those that don't know me. So my name is Dr. Ben. I'm one of the physical therapists at Pro+Kinetix Physical Therapy and Performance, and we've been seeing a common theme over the last about week or two. And so I wanted to hop on here and talk to you guys about it to help you guys not fall in the same pitfalls that some of our patients, our newer patients that have been coming to see us, have been stating that they're going through. And that is that we're dealing with a lot of newer patients that are coming with chronic issues, things that have been going on for years. And a common theme across all of them is like, oh my gosh, I wish I would have done something about this sooner. Okay, and we're also on the opposite end of that spectrum. We're also finishing up with a lot of patients that were originally dealing with chronic issues that are getting towards the end of the plan of care with us, and they're back to doing everything they want to be doing, and they're like, oh my gosh, this was such an easy fix. I can't believe I let this go on for 2, 3, 4 years. I think there's one patient last week that they had been dealing with injury for over a decade, and they went through I think about 9 or 10 sessions with us, and they're back to doing everything that they want to be doing again. And so I just find like I don't want you guys to have to go through the same thing as well, and have that regret too. So yeah, I want to talk about to you guys today about the number one thing you can do to prevent injury from turning into a chronic issue. So why do issues turn into a chronic problem? Okay, usually it happens due to not taking care of an issue soon enough. Okay, usually these things are very minor, like they could be like an ankle sprain, for example. Okay, that lead to chronic issues that actually aren't ankle pain related, but knee pain, hip pain, low back pain, even shoulder pain that is stemming from a minor acute issue that started with something as simple and as what a lot of people think as minor as an ankle sprain. Okay, and as PTs, we see this all the time, and we wish we had the opportunity to address it and nip it in the butt when it was a simple fix, instead of letting this turn into a chronic issue. So why does it turn into a chronic issue? It's usually due to actually movement pattern deficiencies, not actually the actual injury itself, but actual deficiencies in movement patterns that have become an issue due to other minor issues such as an ankle sprain, or just tweaking your knee, or tweaking your shoulder and starting to move in different ways. Okay, so for example, with if we have an ankle sprain, a lot of times people just don't really do anything about it, and they just kind of go about their everyday life, and they just hope that it'll go back to normal. And over the course of time, that pain will subside, and they think that issue is taken care of. But in reality, what happens is the pain may be gone, but that range of motion that you had in the ankle probably isn't the same. And when we walk, or with our gait or walking patterns, if we don't have the ankle mobility that we need for like walking or running or like squatting, then we have to start having compensations from the knee joint and the hip joint and the low back as well. So a lot of times when somebody comes in with knee pain or hip pain or low back pain, it's actually a lot of times stemming from an old ankle injury. Okay, especially if they're a basketball player or volleyball player, or where they're playing sports, or soccer player, or sports that has a higher occurrence for ankle injuries. Okay, so another reason that injuries turn into a chronic issue is due to fear. People stop moving, which makes things even worse in most cases. Okay, a lot of times if you go see a physician about an injury, they say, yeah, just rest for a week or two and see how it feels. Okay, but in reality, this isn't one of the that you need movement. Okay, because if you don't use it, you lose it. Just like just how I was explaining the ankle issue, because somebody wasn't on their ankle as much because of an injury and doing the activities they normally would be doing, that ankle starts tightening up, and that range of motion becomes limited. And it's not that you lost that forever, but you just might not realize that how much it's actually impacting you. So you're not doing corrective exercises to address it. Okay, so the big thing is fear. People just are worried about making things even worse. They stop doing a lot of activities that they love and stop moving as much, which it causes not just problems with that current issue, but it a lot of times makes you even weaker in other areas. And on top of that, it impacts your quality of life as well. Okay, and a lot of times you don't actually have to stop doing the activities you love just because you sustained an injury originally. Okay. Other complicating factors are just like believing that your body is fragile. A lot of people think that you have to move in a certain way, or you can't bend over, you can't run because it's bad on your knees, or you've been told that by people. And so people just are worried about like re-injuring or making things worse, which is a viable concern. But that just um, it goes to the fact that you need to make sure that you're seeing a professional that is going to help you be able to get back to doing the activities that you love, because the body isn't fragile. It's actually very, very resilient as well. So other complicating factors, yeah, too much rest, not just taking complete months off, or even years doing the activities that people love, just because they feel like they need to rest an injury. Rest for about a week or two, before, and then you need to start reintegrating movement back into your daily life again. Okay, and then also other complicating factors, just like avoiding certain movements forever. People think that, oh, if I have a back injury, I should avoid bending over for the rest of my life. And some of you might be laughing, don't have like a back injury, but it's a real concern that a lot of patients do come in with, that they've been told by other practitioners that they just shouldn't be bending over, because they could throw out their back. Okay, which isn't 100% true. They just need to learn how to move in an effective way. Okay, and relearn how to move correctly. Okay, or simply like people think that they need to stop running forever because they had a knee injury. Okay, when that's not true as well. Okay, movement is what. Next point is like movement is what will get you over an injury the quickest. Okay, and at the beginning phase, it's like when you first have an injury, there's very specific movements that we need to start with and progress from there. Okay, and they shouldn't be randomly selected from YouTube. These should be prescribed and administered and given to you by a professional, whether it's us, a physical therapist, chiropractor, your physician, what have you. You need to make sure that they're very targeted to your issue, and you shouldn't just start throwing darts at a dartboard and just hoping that one of them will be the bullseye. Okay. As movement professionals, we can get very targeted and save you a lot of headaches and frustrations there. Okay. So, that being said, if you guys are wondering why an injury isn't going away and want answers, reach out to us, whether it's submitting through our website, sending us a direct message, or simply giving us a call or a text. We respond to text. That's something we do a little bit differently at Pro+Kinetix. We also leverage and utilize text quite a bit with our patients as well, especially between sessions, making sure that they're doing okay between sessions. So, anyways, we'd love to learn a bit more about what's going on and answer any questions that you may have as well before we get you scheduled. So, if you have questions, feel free to reach out, and we're here to help and make sure that these acute issues don't turn into chronic issues, or if you're dealing with a chronic issue, that it doesn't linger on any longer than it needs to. So hope you guys enjoy the rest of your Tuesday, and then we will see you guys later. Thanks, guys.